Well, what people have been fearing for some time has finally happened. Uh, the An Ebola case has crossed the border from the Democratic Republic of the Congo into Uganda. And we get this press statement from the Ministry of Health in Uganda yesterday evening. And it says the Ministry of Health would like to inform the public of the confirmation of an Ebola virus disease outbreak in Kasese District, Uganda. The confirmed case is a 5-year-old boy who traveled from the DRC with his mother yesterday on June 10th. The mother is of Congolese origin but married to a Ugandan, and they reside in Kasese District. However, she had traveled back to DRC to nurse her father, who succumbed to Ebola. The mother and the child were accompanied by 4 other family members to Uganda, who are all Congolese. The child and his family entered the country through Bwera border post and sought medical care at the Kagando hospital, as the child was not feeling well by the time they came into Uganda. The child presented with the following symptoms: vomiting, bloody diarrhea, muscle pain, headache, fatigue, and abdominal pain. And it goes on to say that the blood sample was drawn and sent to the Uganda Virus Research Institute on early morning of the 11th, and it tested positive for Ebola virus. And 8 contacts have been listed, and they're being followed up on. And it goes on. In conclusion, the Ministry of Health, World Health Organization, and CDC will undertake ring vaccination of contacts to the case and other non-vaccinated frontline health and other workers beginning Friday the 14th. Anyway, so it finally happened. We were kind of all expecting that. And the DRC Ministry of Health also put out a release, and they wrote, we would like to thank the Ugandan health authorities for this effective cross-border collaboration. As a reminder, from the beginning of the 10th Ebola outbreak in DRC, the Ministry of Health is working in full transparency with the health authorities of neighboring countries to prevent the spread of the epidemic in this region. A sanitary control system at the entry points of DRC is organized by their border people in collaboration with the World Health Organization for Migration. It is this system that allows for the rapid detection of contacts of confirmed Ebola cases who are traveling and trying to cross borders to escape health control. On average, 20 to 25,000 passengers cross the border daily at the Kasindi port of entry. Since the beginning of the epidemic, more than 65 million travelers have been checked at the various entry points and checkpoints set up. So a lot of people crossing these borders, and for almost a year, no Ebola transferred out of the DRC. Helen Branswell over at Stat News reported on this quite early, and she says that the news will likely increase pressure on the World Health Organization to declare the outbreak a public health emergency of international concern, right? They've declined to do that a couple of times during this outbreak. The agency's Director General, Dr. Tedros, told Stat he will convene an advisory body called an emergency committee as quickly as possible to review the situation and decide whether the outbreak now poses a global health threat. Dr. Mike Ryan, who heads the WHO's emergencies program, said the meeting will likely occur within the next day or two after the agency consults with the governments of Uganda and DRC. Ryan said Uganda and partners have been working for months to protect the border against just this type of event. It's never good news to have Ebola, he said, but suggested that the preparatory work should help contain the threat. So, yeah, things are going to start moving really, really fast now with the Ebola thing, I believe. And they're right, Uganda's really pretty good at this. They have a good history of containing Ebola. And here's Dr. Tedros on Twitter, and he, several hours ago, was commending the Ministry of Health of Uganda for responding quickly to the identification of the Ebola case. Uganda has experience managing Ebola and has been preparing for months for this eventuality. So we'll see how that goes. And he also says Uganda has vaccinated nearly 4,700 health workers and 165 health facilities, including the facility where the infected child is being cared for, as part of their preparedness for a possible imported Ebola case. And yesterday afternoon, the CDC also put out a release, and their subheadline does say that the risk of Ebola virus transmission in the U.S. remains very low. So we must keep that in mind. We don't want any panic over that. And what they say is they were notified and said this is the first time that a case associated with this current outbreak, which began in northeastern DRC in August of 2018, has been identified in a neighboring country. This is the first case of Ebola in Uganda since 2013, and the first time that Uganda has reported a case of Zaire Ebola virus. The CDC director, Robert Redfield, he said this is a sobering development that everyone has been working to avoid and highlights the complexity of the Ebola outbreak in DRC. Despite this first case of Ebola in Uganda, officials in DRC and Uganda, alongside partners throughout the international community, are dedicated to bringing the outbreak in Africa to an end. CDC is working with our response partners to rapidly detect and prevent additional cases in Uganda and to prevent further spread of Ebola in DRC and to other neighboring countries. So, yeah, CDC has a team over there working on this as we speak also. And let me close out with giving you a little bit of history of Ebola in Uganda. And like I said, they are pretty good at this. They haven't seen an outbreak since 2012, 2013. And that outbreak had 6 cases. And as the CDC mentioned, they've never seen Zaire Ebola virus before. In this outbreak, it was Sudan Ebola virus. Then another outbreak in 2012, where there was 11 cases. Again, Sudan Ebola virus. 2011, 1 case, Sudan Ebola virus. 2007, 2008, Bundibugyo Ebola virus, 131 cases. And their first and largest outbreak was Sudan Ebola virus in 2000, 2001. And it was 425 cases. Half of them were fatal. And prior to the West Africa Ebola virus outbreak in 2014 to 2016, this was the largest Ebola outbreak that we have known about. So anyway, this is going to, like I said, this is going to be a very rapidly moving thing from this point on, I believe. So we'll be keeping a very close eye on it. Check out the website, outbreaknewstoday.com. Check out other sources that I've talked about on other videos. And I'll see you next time for the next infectious disease news brief.
And don't forget to check us out at the website, outbreaknewstoday.com. The podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify. And the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.